Hi, I'm Damien Thomas, Head of Research of Development of C4 Diagnostic, and today I will tell you about the technology behind the C4 LFA test and the promising result and how fast and sensitivities test to diagnose Legionnaires disease developed by C4 Diagnostic. Before diving to the result, I will first remind you key factors about Legionnaires disease. Notably, its rapid growing incidence, standard of care, and the medical need today. Here we go. Legionnaires disease is a form of atypical pneumonia caused by Legionella bacteria. This infection can lead respiratory failure, acute renal failure, as well extrapulmonary infections such as endocarditis and rhabdomyolysis. These diseases are most often underlying pathology, advanced age, and delay to appropriate treatment. Legionella disease is rarely seen in children, but this disease is again responsible for 3 million deaths worldwide per year. This mortality rate is very important, up to 10%. That leads again really problematic for public health care. And global increase observed since 20 years confirms that we are not finished with the Legionella disease issue. This underlines the need on new tools for the diagnosis of Legionnaires disease. As I say, since 20 years, we could observe a rapid increase of case reporting of Legionella disease. This case is located in the south of Europe, mainly near the Mediterranean. It could be linked to the warm or maybe the lifestyle. And as you can see on this picture, we have approximately the same repartition when we focus in France. This epidemiology shows that this disease is seasonal, but we could observe a spike during the summer, but we could observe as well some cases in the winter. So this disease is present all over the year. Concerning the diagnosis, Legionella disease diagnosis was done by lots of figures because this disease could be mixed with other, and we need some other information to confirm that we are present of a Legionnaires disease case. Concerning clinical picture, asthenia with moderate fever during the first day is often observed, myalgia and headache as well, and a non-productive cough for the first day. Many cases report that digestive disorder and neurologic disorder appears during the malady for the first stage. Picture with a chest show pneumonia and with interstellar presence of the bacteria in the alveoli. Why it's important to do this diagnostic quick? Because as you can see in this figure, more you treat quick, more you conserve the chance of survival of your patient. After 2 days of delay of treatment, you lost up to 40% of chance of survival. Concerning important figure, since 2018, up to 94% of Legionella disease is reported in France. This is very important. And another important information that the non-serogroup 1 Legionella is more reporting. The fold of increase is by 2.5 since 2017. How we do the Legionnaires disease? Two techniques is mainly used currently. UAT in first intention, because it's a urinary antigen test, easy to use, but this test only tests the presence of the serogroup 1. And this is not could be an issue because non-serogroup 1 Legionella is more and more present and reporting in case of Legionella disease. Concerning the gold standard, which is a classical culture, it takes a long time, sometimes 10 days, and it's not very sensitive and with very variable result. That's why we need to work on that. For the National Center of CNR, this is a tree of decision concerning Legionnaires disease diagnosis, and you can see that antigenary is the first test used to and when it's positive, they do a PCR to obtain the ST type of the bugs, and sometimes the global genome by NGS. If this test is negative, because many cases is not done by Legionnaires disease, they do co-culture with amebia and sequencing to confirm that the Legionnaires is not present. As you can see, this is not so simple to do this kind of diagnosis. C4 Diagnosis is a French company based in Marseille, founded in 2017, specialized in development of in vitro diagnosis tests for human infectious disease. We believe in a rapid and reliable diagnostic tools in order to change the way of infectious disease. For that, we use our click chemistry pathology technology. And I will present you this techno in few slides. This techno is our proprietary technology and is based on the use of synthetic sugar with a B-orthogonal function, and we use this function as a hook. This hook is hit by the bacteria, integrate in the membrane, and we could use this hook to make detection, identification, and concentration. We could use 3 types of sugar. Sometimes it's very specific, such as one of them for Legionella. We use in the test I present in the few seconds. Other sugar are semi-specific, for example, only for gram-negative, and other sugar are non-specific that could be used for all microorganisms. For the Legionella LFA test, which is a rapid diagnosis test based on the click chemistry, we use this sugar. This test is really reliable and useful because it's able to test all the serogroup of Legionella and not only the serogroup 1, and easy to use because you could obtain the result after the culture in 20 minutes. A few words about how it's used. You can take a bowel sample or bronchoalveolar samples, put this sample in the presence of the culture media that contain our specific sugar. After 44 hours of culture, the bacteria grow in and integrate the sugar in the membrane, and we could use this sugar to click our specific tag, which is used to detect the presence of Legionella in the strip of the cassette. This cassette could be integrated in a reader that standards the analysis and result. I hope this test gives you some idea, and if you have some question or need anything, don't hesitate.